So medication management around the time that you start family planning, it does require some adjustment most of the time. But we in a very good evidence situation at the moment in that we understand a lot about the risks that these drugs hold towards unborn babies and also how they behave when you stop them all of a sudden as well. So with many of the treatments, we actually would allow the expecting mother to continue, or if you're doing the time when you're trying to conceive, that you continue on your treatment up until time that you actually know that you're pregnant. So when we say that, that basically means that, you could have the fetus could be exposed to a drug for up to 6 weeks, because that's often the time when people might notice that they've missed a period and they do a test and so forth. So we know that very few of the MS drugs actually have any adverse effect in terms of that fetal development. So the drugs that we avoid at all costs would include darafunamide. For instance, we would also stop fingolimod, which is probably the ones that we would be most concerned about. But then many of the other drugs, including natalizumab or Tysabri, ofatumumab or Kesimpta, even ocrelizumab and cladribine, and dimethyl fumarate, and all the sort of older drugs like the interferons and Copaxone, for instance, we generally, have some adjustments that we make, but we allow women to keep taking them. In terms of taking medication throughout pregnancy, the one drug that we use in that situation would be Tysabri or natalizumab. So what we would usually do is just increase the interval of the infusion. So especially if we're talking about a mum that's been stable all along, we would increase the infusions to say every 6 weeks, 5 to 6 weeks, rather than every 4 weeks. And then we would usually continue those until about week 34 of the pregnancy, and then restart them shortly after the delivery. So it's sort of like a little bit of an adjustment, in terms of, how do we space the drugs? Which ones can you continue right until you get pregnant? Which one should you absolutely stop or switch to something else while you're trying to conceive? And then, restarting them again afterwards.